everybody else also settle in. My name is Irina Vasiliu. I'm from DG Justice and Consumers, and up until 2 weeks ago, I was the team leader for GDPR in that unit, and partially responsible for what you have in front of you today, with many, many others, countless others. Today, we discuss automated decision-making in commercial health. And when looking even at the titles and at the sub-elements, we can already see that we are at the crossroads of a number of sensitive issues. First of all, because we talk about sensitive issues, at least in Europe. Health data is considered sensitive, so subject to a number of rules and conditioning. Second, because with new technologies, we have advantages and disadvantages, both from an individual side, but also from an operators, for economic operators. There are elements of transparency which can be improved, privacy by design, so benefits for individuals, also in their health, but also risks and consequences which we cannot always foresee. And the risks, not only for data protection, but also for discrimination and other rights which can be impacted. And then we arrive at another crossroad, the one between law, hard law, soft law, but also ethics, and how do we dwell into that, and how do we articulate that? And today's panels will also address that. What do we mean by bias? How do we address discrimination? Are we really sure that in this new environment of mobile apps, we are sure that our data is secure, that we know what happens with the data, and more importantly also, what are the consequences? Another keywords to start with: transparency, scalability, accuracy, purpose. What is my purpose? Profiling and automated decision making. A lot of issues, a lot of questions that we will try to address in this 1 hour and 15. And I'll pass the floor now to Michał. Thank you.
Thank you so much. Excuse me. I'm suffering from the cold that I think has afflicted many, many people at the conference. Hi, everybody. Thank you so much for joining. I'm Michał de Mooy. I'm the director of the Privacy and Data Project at the Center for Democracy and Technology. We have offices in DC and Brussels. And for those of you who don't know us, we're a digital rights organization. So thanks for the introduction. You know, I'm excited about this topic. It's something that we're doing research on at CDT. And specifically, what we want to talk about today is the way in which mHealth apps may reflect historical bias and discrimination, and specifically, you know, dig into a little bit the automated processes that power them. We're going to talk about the ethics. And by ethics in this scenario, what we'll be talking about to a certain extent is power. We'll be talking about, you know, the power dynamic between who has access to data, who doesn't, the types of data, and what values are placed upon the data, and what that means for users and what that means for companies. So before we do that, excuse me. Before we do that, I'd like to briefly introduce today's esteemed panelists. And this is truly brief, so I beg you to reference the speaker bios on the Cpdp webpage to learn more about their accomplishments, which are many. First, we have Michał John Boni, who was the Minister of Administration and Digitization of Poland from 2011 to 2013. He is a member of the Civil Liberties Committee in the European Parliament and a substitute member in the Industry and Energy Committee. Thank you very much for being here today, Mr. Boni. Next, we have Claire Gayrel. She is legal officer at the European Data Protection Supervisor. Before joining EDPS in 2016, she was a researcher at the Research Center in Information Society and Law for 8 years, and before that, she worked with international experts in the field of transborder data flows. Thank you very much for being here, Claire. Next, we have Finn Myrstad. He is the head of the Digital Services section in the Norwegian Consumer Council, where he covers issues such as data protection, telecoms, and digital rights in Norway and Europe. Thank you, Finn. And we have Irina Shklovski. Thank you. Irina is an associate professor in the Technologies and Practice and Interaction Design research groups at the IT University of Copenhagen. Her research is located at the intersection of information sciences, communication studies, and human-computer interaction. Irina, thank you for being here. So let's get started by talking a little bit about just sort of level setting by what we mean when we say mHealth apps. There's a huge variety of applications available on the market today, everything from step tracking to measuring a person's propensity for depression or other mental health concerns. So maybe Mr. Boni, you can start us off by giving us a sense of what do we mean when we say mHealth apps, who's using these apps, and what sort of data is being collected?
First of all, thank you for invitation for this workshop. It is not so easy to describe all dimensions because everything is on the way, if I can say. But of course, when we are talking about mHealth apps, I think that we need to differentiate between opportunities and threats and risks, because there are many opportunities related to the possibility to know more about the state of health using those apps, and it should be delivered in the friendly way. It is cost effective, it creates new patients' expectations and the need of the new model of medical services, because this is a big correlation between the information of the state of health and the possible better, deeper diagnosis and much more adjusted, personalized therapy. So there are many, if I can say, opportunities. In some situations, monitoring in the real time using some devices, sensors informing us about the state of health are very important to save the life. Yes? So I think we need to remember. And this is the also additional point and additional opportunity, because using those mobile health apps, we can know more about our individual health. So we are starting to be much more responsible for our health. But of course, there is a differentiation between apps who are much more focused on well-being, lifestyle solutions and so on, and those which should play the role in the chain of healthcare area. And I think that we will, that if we will want to in the second purpose to use mobile health apps, we need to discuss about certification, we need to discuss about standardization, we need to discuss about validation, and of course we need to discuss about high quality and making the results of some measures done by some devices much more comparable. So this is one aspect of those risks. And of course, we need to consider that one of the key issues is sending the data to whom? To my doctor, to the center of monitoring, and it should be clear. And my choice that I'm in relation with my doctor should be done by me. So this is my choice, my definition of the cooperation. So of course, when we are starting to discuss about health apps, we need to discuss about proper implementation of GDPR. We need to remember about proper shape of e-privacy solution, which is on the way, and I hope that during this year we will finish the work. And also we can use some soft law solutions, as for example discussed through some 3 years, this code of conduct on mobile health, but without clear result now. Yeah? So because we are waiting for the opinion and for the adjustment of this code of conduct to the expectations presented by the Article 29 group. So there are many possibilities and opportunities, but on the other hand, we need to remember that at the end, we are, as individuals, as users, as patients, with our need to control our data.
Thank you. Does anyone have anything else to weigh in sort of on the world of mHealth apps and who is using these apps? Irina.
Sure. What I wanted to add to this really important set of points that have just been brought up is that the world of mHealth has exploded recently, and it covers now an enormous diversity of various different services and opportunities. I mean, we have applications that address specific diseases. There's a number of applications, a number of technologies that address chronic disease management. There are generic health services, especially health services that are deployed in the global south, and they vary in participation of medical professionals. Some need medical professional participation, some don't, and they vary in data practices and opportunities. And then there is an enormous set of applications and technologies that can be described as lifestyle and wellness types of applications, and it's not clear really how closely connected they are to sort of traditional medical understandings of health. But all of these then become this enormous umbrella of medical health applications. And the issues that they grapple with are going to be somewhat different, because the kinds of data that people that are using these technologies for chronic disease management are going to be wanting to disclose to their medical professionals and potentially in emergency situations are going to be different than the kind of data that you're going to be wanting to disclose from your Fitbit. And the reasons for these disclosures, and of course all of these data are sensitive, but how that needs to be managed also needs to be addressed, and potentially can't be addressed all in the same way.
Thank you, that's really helpful. And so sort of broadening and getting into the topic of there's a lot of different apps that are doing a lot of different things for us, but collecting more and more sensitive data, and of course breaking that data apart and marrying it with other, appended data, applying analytics to that data to sort of extract more and more value from it. So clearly health data is sensitive already. What does it mean when we have these sort of added layers of analytics or targeting, other types of things like that? So Claire, maybe you can give us sort of a broad perspective on what are the ethical questions. And again, by ethical, part of what we mean is privacy and security. Those are power dynamic questions as well, but also community questions. What does it mean for one community versus another community? How is the impact the same or different? So Claire, would you mind giving us a bit of an overview on that?
Yes, of course. Yes. Indeed, I wanted to bring a broader perspective on the ethical issues raised by mobile applications. Mr. Boni said rightly that these applications are also meant to empower individuals with respect in the management of their health, etc., to make them more responsible. And because they empower them, they will take care of their health, they are in control, etc. This helps them to be in control of their health, etc. And I would like to bring a little bit a critical view on this assumption that mobile applications contribute to the empowerment of individuals. There are different applications, it has been said. The ones that are of more interest for this discussion is maybe the applications for prevention. These applications in general, they aim to motivate lifestyle changes, loss of weight, reducing tobacco, moderating your alcohol consumption. We have to know as well that the loss of weight represent a huge part of the market of mobile applications. It also shows, in which society we live, how many applications are dedicated to that is just amazing, And how they motivate lifestyle changes, of course, through automated processing, profiling, measurement of many of your data, etc., but also using some nudging techniques and building an architecture of choices, an architecture of recommendations to incentivize your this lifestyle changes. And nudging, it's well known, has been increasingly applied in the public health context to motivate such behavioral changes, because the benefit is that if you change at an early stage and avoid risks and practices of risk, you will then, the health system will not have to take care of you later on. So it is assumed that mobile health contribute to the empowerment of patients and that they could manage their health more actively and independently. But the first ethical question is transparency, not only with respect to the automated processing behind. These are complex, we know, increasingly complex. The issue of transparency is now, I would say, a well-known problem of algorithm and how they function, but not only in the processing of data or personal lifestyle or whatever, but also how the architecture of choices, recommendations is built. And why? Because nudging strategies are often, or more than often, more efficient when they operate in the dark, if you are not aware of that. So, by definition, certain categories of nudging may, by their nature, infringe personal autonomy, and some are more problematic than others, but this should also be considered, how they are introduced. And if you combine a well-advanced profile on the basis of big data analytics, etc., with nudging practices, the combination of both may raise even new ethical questions that we didn't have before. What about the use of the reward strategy, which is one of the well-known strategy of incentive in the practice of nudging? What about the reward strategy to motivate people stopping smoking or losing weight? This is applied in some application. They block your money because you didn't smoke today. This is all the money you saved, you know? And so they block it for a while, and at the end you have a kind of reward because you succeeded or not. But what about the ethical implications if the data controller knows because your current economic, social, or psychological condition makes you very unlikely to succeed in meeting the criteria, and makes very unlikely to stop smoking, because they know that you are not in a period favorable for that, whatever. And they are able maybe to know that, or get a very close probability of your ability or not. So the use of reward strategy is also used sometimes in the insurance sector, consisting in offering bonus plans or for premiums, insurance, or things like that. And even if they are of a very low financial, interest, I think this is not even a question of the how much you earn with that or not. But this also creates an indirect pressure on individuals to use these applications and to share their data in order to get this type of reduction of whatever. And the broader question I would like to raise in relation to this assumed or supposed empowerment of individuals is the one of solidarity. Consideration must be given to the potential consequences of making people increasingly responsible for their own adverse state of health. Putting too much emphasis on the empowerment of individuals through the multiplication of mobile health applications supposed to accompany, help us in being more healthy and better in our in condition, etc., and to help us in having good lifestyle, etc., may slowly but surely break solidarity among people. Because inequality in health is not only the result of individual choices, but is also the result of economic and social inequalities behind. So this is a broader question and a broader issue, but this empowerment, supposed empowerment of individuals, and putting so much emphasis on this may slowly, get us to the feeling that I don't want to pay for the one who smokes. Mm-hmm. I don't want to pay for the one who drinks, or for the one who are drug addicted, etc. And we may slowly but easily go into that direction and consider that this is their responsibility. They didn't have a good lifestyle, and so we are not going to pay for them. And I come from a country where the universal social security system is applied. So that's also why
that's really helpful.
I'm raising this question.
Yes, yes. I think that was an excellent overview. Thank you. And Finn, I know you've done a little bit of research in this area. Can you tell us about that?
Okay, yeah, I'm happy. I'm Finn from the Norwegian Consumer Council. So what we do is we're a consumer interest group, and once in a while we do these deep dives into different areas of consumer interest. And a lot of it has been looking into apps and fitness trackers recently, where we look at the terms of service and we look at the technical features of what goes on inside the app or inside the device. And I think these were really, really good points that you made. And so I'll add some of the practical knowledge that could be sort of observations. What we've seen, obviously, is that a lot of these apps also fail at the beginning, where they have really poor informed consent. We can't really talk about informed consent. We tried to read the Fitbit terms of service and run on a treadmill at the same time. And it took us more than an hour of running before we had actually finished reading the terms of service for Fitbit. We tried to read the terms of service on an average phone. It took us 33 hours to read the terms of service on the apps on the phone. So the point is that we see that a lot of really important decisions are put in the terms of service, and you actually, as a consumer, you waive a lot of fundamental rights, and obviously that's not legal, but it happens every day. And sadly, in our research of fitness apps and fitness trackers, all of them failed complying with basic European legislation on consumer rights and data protection regulations that are in place today. So I don't even want to think when we do our next sweep of apps after GDPR, the 25th of May, what we'll find. But I really think that the apps need to really step up their game, because, as you said, there are lots of potential benefits as well coming with health apps and services, no doubt about it. But just from that point of view, it's very questionable what's going on today. But also what we've seen from our data analysis from certain apps, and I'll just mention one example because it illustrates the point. We looked into the running app Runkeeper. And first of all, they had terms that were illegal, according to European law. But we also discovered in the data flow analysis, because we looked at where does the location data go, and where does this go, where does that go. Jomette, one of my colleagues down here, she looked through the data analysis, and she discovered, oh, location data is being sent when the app is not in use. And it's being sent to a marketing company in the US. What's going on? And obviously, this was a data leakage that wasn't supposed to happen. The app was not supposed to track your location when it was not in use. And this company that was then doing advertisement, and this is the point that I'm making, was not supposed to have this data. So we filed a complaint with the Norwegian Data Protection Authority, but we didn't need to actually have them work with the complaint. But Runkeeper then issued a statement saying it was a bug. And they fixed the app for all the 50 million users around the world. They fixed the bug. The problem was that this has been going on for years. We found a blog dating back 2 years notifying this problem. And the point I'm trying to make is that we see it's a very complex data, how to say, commercial landscape out there. And currently, all the apps most of them at least, are transmitting very sensitive data to lots of third-party actors. And that's when also, to add to your point, lots of ethical considerations about who gets access to health insurance. It's not only sort of individualizing health insurance, as you mentioned, which is a very good point, but lots of people might not even get offers of health insurance, or might get a more expensive health insurance. You might also be lumped into categories, or you are depressed, and you will have, because of your movement, you can estimate whether someone is, for example, depressed. Obviously, that's also lots of things that can go wrong in that analysis. You shouldn't make it. But then, of course, you can also be targeted with advertisement when you don't have your natural defenses to say, no, I don't like this. I don't want this junk food or these payday loans, for example. So there are lots of other wider societal issues which, in the programmatic landscape of advertisement, which the current business model seems to be with a lot of these fitness trackers and health trackers, it needs to move away from this, and they need to really try to find business models that are not based on selling people's data, because that has huge implications for people's lives that we don't really know yet. And I think if we get there, consumers will embrace a lot of these services, and that should be a win-win for the industry and the consumers. So that's just like a small introduction. So we see a lot of things going wrong at the moment, but we see that there is a potential.
We're going to paint a bleak picture, but then we will try to raise it up a little at the end. So part of, just to dig under this just a little bit more, right? So maybe some of this you've already known, or you've maybe heard about a little bit. And so part of what we want to do with this panel is ask how the technology that's powering these apps it comes into play also, and may be a part of furthering historical bias or discrimination. For example, different analytics models that are used by mHealth apps may, in fact, embed structural bias. How do they do this? Well, they decide the values of the data points, right? So they will say, we care about this, we don't care about this. And some of that is based on the data that has already existed, research data, which of course is almost always based on people who are white, who are wealthy, who tend to be very healthy, right? So people who are not that end up being compared against. Those are sort of the standard, right? For example, BMI, body mass index, is a metric that has been debunked as something that is truly a measure of health. And yet, almost all of the trackers that you see, the weight management apps, all kinds of apps, use that as the standard. And if you don't measure up to that, well, then you're overweight, or it doesn't take into account cultural differences, different body types, et cetera. So to tell us a little bit more about this, Irina.
Sure. So one question, does anybody know where 10,000 steps came from? So everybody, 10,000 steps, that's the standard. Everybody's got to go to 10,000 steps. Well, 10,000 steps comes from an advertising campaign from Japanese step clubs in the 60s. And they picked 10,000 because it was a nice number, it was round. And it had nothing to do with health. It was just, there were step clubs, and they were, counting steps manually. It was a thing they were doing, and 10,000 steps looked like a nice number to get to. And now we're all doing 10,000 steps. I'm starting with that example to make a particular point, in that when you have a technology and it's using sensors to measure things about you, to say something about your health, it's only going to measure what it can. So right now we have accelerometers embedded in all these technologies, and occasionally we have some gyroscopes and some other things. A lot of them have some more fancy bells and whistles, but by and large, those are the basic technologies, and they can only measure so much. So if you've ever been in a bumpy car, you can watch your step counter count steps as you're driving, and there's nothing you can do. It'll just continue counting steps. Because there's two things that are happening here. One, these technologies are fairly simple. They can't make a complex technology to really accurately measure things like step counting, like the steps you make. Really, your legs are moving, your sensor is on your wrist, and it's counting your steps. Think about that a little bit. Heart rate, calorie consumption, sleep, all of these are estimations. And they're estimations based on a range of data that's collected by some fairly limited sensors. Now, we now have exceedingly good algorithms that could potentially pretty accurately recognize some of these, but under ideal conditions. Most of us don't live in ideal conditions. Most of our lives are really not ideal. And a lot of times, one of the problems, there's a Stanford study that was done recently, and they found that the range of accuracy for these sensors and the kinds of interpretations that algorithms make ranges between, they're inaccurate from 27 to 89%. So some are sort of accurate, some are wildly inaccurate. Your calorie counts are typically completely off. They're actually incredibly inaccurate. But your step count and your heart rate are typically reasonably accurate. Now, these devices are consistent. So if you're comparing yourself to your previous self, then more or less that'll be reasonably accurate. But they're not precise. So from a medical point of view, they're actually not telling you precise numbers. And there's a conception of health underneath all of this. Somebody's decided that 10,000 steps is what you all should achieve. Turns out it was not what you believed it was. But we've all decided that 10,000 steps is now the goal. Now, health is as much is also a social construction, in that we decide what it means to be healthy and what kinds of things we need to achieve to be healthy. And now we have technologies that are embedding these ideas into the kinds of designs that are making. And if those designs are coming from lifestyles that are depending on cars, then riding a bike is an event. Now, I live in Denmark, in Copenhagen. Riding a bike for me is transport. My step counter tells me I don't walk enough, because it can't really tell that I'm riding a bike. And I don't really want to press a button every time I ride a bike, because I do it all the time. But it's not designed for people like me. It's not designed for people that travel. It's not designed for a lot of things. It's designed for a very particular kind of lifestyle. So not only are we trying to achieve 10,000 steps, but we're also trying to achieve a set of goals that are set with a set of expectations that potentially don't actually fit the lifestyles we lead, not because those lifestyles are unhealthy, but because the structural conditions of our lives are different. And if we're talking about empowerment, empowerment is not empowering if the structural conditions of your life are not changed. Then it's just responsibility.
Thank you. Do any other panelists want to weigh in on this topic? Oh, please go ahead.
Two things. Thank you very much for those big list of many risks. So we can stop work on making it much more improved, yes, analyzing on the risks. But first of all, very often we are talking about some threats and risks, not considering that GDPR will be implemented. So we are describing the situation as it is now. Okay, but on the other hand, our 5 years work on GDPR should help us to describe the situation better when we will have GDPR and also e-privacy solutions, because they will change many, many things. Now it's very often very simple to send the data, to share the data. There will be many limitations, many, many limitations. So I think that it is not so good to talk with people and to say, okay, there are many threats, because your data could be disseminated all over the world. Because if we will have GDPR properly implemented in many countries, because we need to remember that there are many options for countries, especially related to healthcare area, especially related to sensitive personal data. So I think that situation will be much more better. It doesn't mean that we should resign with monitoring of those issues. Second point is, I have suggested to separate the discussion on those well-being, lifestyle, medical health apps, and okay, we can discuss about it, yes, of course, but when we are talking about real impact on the healthcare system, we need to discuss about those apps which will be the part of the chain taking some information. We will be informed, and we need to present our consent with our doctors, yes? And I'm sorry, if my doctor will know more about many my activities, many my deficits, he will be prepared to give me, to offer me better therapy. It's clear. Talk with doctors. Talk with patients about it, yes? Because I think that the question is how to, in balanced way, create the proportional solutions, yes? Mm-hmm. Saving us and saving the data, and on the other hand, create the good background and environment for using those data in proper way to make medical services much more personalized and much more effective. It's very, and the last point, of course, I agree that this is a question of individual responsibility and solidarity and public opinions and public policies, of course, but without the better knowledge about individual conditions for the state of health, it will be impossible to create better individualized, personalized therapies. On the other hand, we need to discuss how to make those solutions accessible for everybody. Mm-hmm. This is a question. So this is the next question, how to make it accessible for everybody. and make benefits for everybody. And of course, find the solution how to finance it, because this is one of the issues. It is not completely not clear who should finance this kind of activities, how to incorporate those solutions after standardization, after certification, to the public health systems. So, okay, many doubts now, but many opportunities for the future, and the proper roadmap how to use and how to take those opportunities.
No, I think that's right, and I think, do you want to weigh in? Go ahead.
Just for a second, maybe to follow up on what Mr. Boni said, I think also depends where we put the grid and the lecture grid on empowerment, and how do we square empowerment at what level. Maybe we should put it in a reality way. Empowerment in data protection terms, we need to also make it more palatable. I need to know what's happening with my data, and maybe start from there. Because indeed, if we have more aspirations about empowerment, maybe this is where we also try to have more than what we get. And then indeed to buy in the solidarity element. And also I think we need to think about the comments that was just made by Finn also on recipients and who gets the data. And this is important if we go back to who gets the data for what. I think this is extremely important. Do I only get it for the basic first reactions of my app services? Will this be also used for research? What type of research? How is this also regulated? And I think that is another element that we have also to factor in the discussion.
I think that's a great point.
I'm sorry. In GDPR is clear when we want to use those kind of data for research, they should be pseudonymized and anonymized.
Which I think is fantastic, and coming from the United States, like a godsend. I mean, it's great. But I think the point that some of us are making is that the structural sort of inequalities that exist can get exacerbated by some of these. And so it's not that these are useless, but they are limited in utility maybe to certain communities, especially the communities that we want to use them, right? So if you have health apps that are trained on data that embeds a lot of historical bias, isn't responsive to different communities, and then you have that data that's flowing into physicians' offices, which is great, but then that data is also flowing into public health research, which informs our medical practices, which informs what we fund and what we don't. So, you know, it's about sort of trying to find solutions and mitigating this issue so that it is more accessible to people and it has more utility to more people. So, and you rightly brought up the legal and policy implications here, which I think, you know, GDPR for sure will have a huge impact in this industry. Do others want to kind of weigh in on how the regimes in the US and the EU make a difference here? Maybe Finn?
Yeah, I completely agree with you that the GDPR will help a lot. But I don't think GDPR will help with the sort of ethical implications that you brought up, because I think those will be that's how you make the models, how you choose to sort of use the data, and I think that's way too opaque today. And the sad fact at the moment is that we do see that too many of the actors who are involved in this field at the moment are using the data for completely other purposes than giving us a better health. There are lots of really good services and products out there. They're coming on the market. But sadly, and I'm going to talk more about this later in another panel because I'm stepping in for a colleague, so stay on after the break. But we've done a study of blood sugar and blood sugar measurements and blood pressure measurements. And what we see there is they're actually very correct, so people can monitor their own health. But we see that the security, cybersecurity, I know that's something you work on a lot, so is really bad, and the privacy implications are huge. And because the data is shared. So we really think, to answer your question, I think what we need is a much better dialogue with the industry. And the industry really needs to show that they're not going to have a data-driven commercial approach to this. They should show that they are focusing on the health, and it's really important that they show commitment. So I think we should talk about, I know we'll move on to that. You mentioned certification is super important. I think transparency of algorithms, letting researchers access these black boxes is super important. Consumer groups like mine are also going to use consumer law in addition to GDPR, I think, to sort of take cases to court. But I think the industry really needs to step up and show that they have a different business model than what the majority of the partners are doing now, and especially within security and privacy.
Yeah, just to come also on the issue of the legal framework in the EU. Again, I think, like Mr. Boni said, we cannot put in the same room prevention applications driven by profit interests, by private companies, and health systems, which may involve private stakeholders, but which are driven by public health goals, etc. I think we are talking about different worlds, and what is at stake, the collective interest at stake, may weight more or less in one area, not in the other, etc. So in general, even when we talk about the legal framework, it will be very different, because in the case of, in the health system case, you may have specific legislation that will come on telemedicine, etc. This is already the case in Germany, for instance, where I discovered, I didn't know, but making some sense, I discovered the ban on remote treatment. If doctors are not permitted to treat patients by means of telemedicine applications, if they have not met you first in person and have not, proceeded to proper consultation, etc. So you will see in this case, the German legislature made a balance, considered some ethical implications, for instance, what is good in using health applications for telemedicine, how we want to do it or not, etc. Which is not necessarily the case for the purely private sector and motivated by other, goals. And there, the code of conduct is, you mentioned certification, and in the GDPR, all the tools that are now offered to bring companies towards compliance with the data protection requirements. The code of conduct for mobile health applications may be a valuable contribution, because it will be addressed specifically to app developers, the industry in particular, and try to raise awareness also among these app developers about what is privacy by design, how consent should be collected, what is health data as well, because this issue of lifestyle data and the frontier, whether lifestyle data falls or not within the category of health data, requires an assessment of the context of the processing, etc. And so there is a lot of awareness raising necessary to invite the private sector, but still, even for data security, I'm also a bit like Mr. Boni. I hope, I expect improvements, and the GDPR is coming. Let's wait a little bit and see if things can get better, and we hope that. And then, even after that, of course, how do you invite all the community of app developers? There are about 90,000 mobile health applications on the market today, an estimation. How do you bring all these different people into the commitment for a better health, that they are working for our better life and better health? Here, I think that we have a big challenge.
I fully agree that we need to raise the awareness. This is one of the key issues, and very often we need to establish and develop some kind of digital medical literacy, not only among us as users and patients, but also among doctors, among physicians. And this is a very specific debate on those issues. So users, consumers, institutions are discussing and negotiating from time to time with business. My view, when we are talking about mHealth apps and changes at the healthcare area is stronger. We need to cooperate stronger with professionals from healthcare area, with doctors, with physicians, yes? Because when we are talking about data, representatives of business will say that all kinds of data are needed. When we will talk with doctors, they will say, probably, okay, this kind of data, after standardization and certified data and so. So we don't forget about our strong partners. When we want to make something for patients, we need at the same time to cooperate with doctors and physicians, etc.
I just wanted to make a comment here. We've been discussing a lot about data, and I think that's very important. But I think in this case, it's also really important to point out that there's the data we're talking about. There are two different, several different kinds. On one, there's the raw data that's coming off the sensors. On the other hand, there's the data that is the interpretation of the raw data that's coming off the sensors, and those are different things. So the technologies that are embedded in these, the algorithms that are embedded in these technologies are amazing. They're actually incredibly complex. And despite the inaccuracies, they do an incredible job of taking very noisy data and creating something that you can actually interpret. At the same time, each implementation is different. So you'll take the same raw data, but you'll actually come up with a different number of steps. Slightly, but still different. Slightly different heart rate. Slightly different calories. So not only do we need to think about some sort of legislation really talking about data, which data it is that we mean here, but also what do we do, how do we communicate to the consumer that this is accurate, sort of, not completely. Each implementation is different. How do we communicate to the consumer that what they see as heart rate from their Fitbit may not be accurate all the time? These kinds of things can be actually quite important. So if you're working on if you're, for example, trying to lose weight, and it's telling you you've expended this many calories, and you think, okay, well, I can let myself eat that cookie. But what if it's wrong? How does that work then? Whose responsibility is this at that point? There's, I think the issues of accuracy are important when we're talking about health and the use of these technologies for health versus the use of these technologies as a lifestyle technology.
I think that, in the United States, just to represent that policy viewpoint, this is a growing problem. That's structural. That starts with the. I think those were excellent points that you just made, but there's very little accountability for it, and it's mostly because a lot of this data is not protected by HIPAA. HIPAA is the health privacy law in the United States that covers 3 entities and their business associates. So health insurers, health information exchanges, and providers. So that's a very limited world, and when we're talking about these commercial entities, of course, a lot of that data is flowing outside. When you show it to your doctor, then it is inside HIPAA, but HIPAA is sort of a strongly suggested, mostly the provisions are suggestions, right? I mean, there are some provisions that are requirements, but most of the privacy and security rule are sort of strong suggestions that you should do. And so areas like this that sort of blur privacy and security when we're talking about ethical things or issues related to this, it gets really difficult to know where do we point to for accountability. And I think in the United States, one place that we could do that would be the FDA. The FDA has taken a very hands-off approach to many health apps, which I understand. I think the idea is to grow innovation, and sometimes regulation can stymie that, and that's definitely true. But on issues like accuracy that Irina brought up as being so crucial to the promise that's being made here, right? That the app is actually functioning as you think it is, and it is actually then contributing in some way to your idea of health or to what you're trying to do. That would be a place where I could see in the United States where some accountability could be regulated by the FDA. Others want to weigh in on the policy and legal implications here, I guess?
Yeah, I can share with an example again. I think it's useful. So I have a report here. It's a report we just published in October. It's for a report on smartwatches for kids. And these watches are GPS or GPS functions. They have telephone functionality. Some of them also detect sleep patterns, and and basically collects health data. And what we discovered there again was these huge problems of a very, very confusing supply chain of this product being made in a country far, far away from here. An importer who had no idea what they were importing, and a store that had no clue about what they were selling. And when you try to keep, and when you discover this, who do you call and who do you hold accountable? And I think we've seen that as well with the health apps we looked at, is that they don't really necessarily also understand what kind of data they are handling. So you mentioned health data, lifestyle data. We had a case in the Netherlands with Nike Plus. Is there anyone from the Dutch Consumer Data Protection Authority who looked at this and told Nike Plus, you guys are actually handling health data because it's data about someone's health, even if it is running data or something. So they concluded it was health data. And I think it starts already there. So there's very little awareness. So I thought your idea about certification is very good. And I think that should probably be mandatory, because what we see is that when we then file this, and one of the problems, and this could easily have been a more advanced health product, it runs under different brands in each country. It's the same watch. It has a different legal entity, each importer in each country. And so when we discover these massive, massive breaches it's the worst thing we've ever seen, to consumer law, data protection, security, actually we could only help a few consumers in Norway. There was no way of keeping anyone accountable. So I think really for us to have the trust that we need with the consumer, because we have studies showing that there's a real cooling off effect when people are worried about their personal data. 1 out of 2 Norwegians, as 50% of our population, has not downloaded an app because they're worried about their data or data protection issues, which really shows that there's a huge missed opportunity here for actually making a good business too. So I think within the health field, because it's so important to people, and when you are a consumer in the health field, you're very vulnerable. We don't talk about vulnerable consumers. You're not vulnerable all the time. You're vulnerable in certain situations. But when you're worried about your health, that's when you're vulnerable very often. And you want these things, because if it can help you, you will embrace it and you sort of close your eyes. And this is why we need policy and we need enforcement, because we have to help the consumers making this a safer playing out. So I think mandatory certification, definitely. Liability should be clear. Who do you hold accountable? We're thinking about holding the stores accountable, because that's a point of purchase. But that's, of course, challenging when you buy online from a different country outside the European Union. So there's lots of stuff here that is very challenging, but we need to address the value chain as well. And I think certification is a good place to start, because then that will trigger maybe in the value chain going back. Of course, I see that it's challenging with certification because technology changes, apps changes, all that, but we need to start somewhere. And we need to hold someone accountable. I think it needs to also be a stick. And I don't think it's always GDPR will help with every case. For example, when there's security problems that are not relating to personal data. So for example, with this watch, we could actually call kids and say, hey, go outside the door, because you hacked the watches. And there's no processing of personal data in that thing, and it would not necessarily be covered by GDPR. So there are lots of pacemakers, you name it, that aren't dealing with personal data, but has a security issue. So I think there's a gap here, and we need to find a way of filling that legal gap.
If I can add something, I hope that we will implement GDPR in Europe in a harmonized way, but I have some concerns. It is not so clear. But on the other hand, GDPR is describing the relation between me as user and company. And there is unlimited world of transferring the data. And this is the reason for which e-privacy is very needed. Because e-privacy is focused on those framework for transferring. So we need to finish our work, because without e-privacy, we will have additional many new problems. So this is point one. The second, I expect that when European Commission will present at the end of this month, if I know, 31st of January, the communication on e-health, all those opportunities, but also concerns will be described in this communication. Of course, this is not legislative document, not legislative paper. This is the beginning of 2018, so I think that there is a small possibility to finish the work if it would be legislative portfolio. But it should create the framework for some years ahead at that area. And in the European Parliament, I can promise we will make everything. We will do our best to add to this report, to this communication, and to create proper framework for e-health development in proper way in the European Union, because it's very needed, yes? And also the promotion of those solutions, this digital literacy, digital medical literacy, raising the awareness problems, because I think this is the only way to talk with people and to find the best solutions, not only under the pressure of business development, yes, because we need to create our pressures, as I have expressed earlier, in a common way by us as patient and doctors, physicians.
Maybe just briefly to react on the two last interventions. Indeed, I think there are not only answers in the GDPR, but at least on accountability, the GDPR is clear. You have a controller, you have a processor. They are the ones, in particular the controller, who have to give justification and to demonstrate accuracy. And I would maybe interact here one element where I think ethics can play. We have the requirement that data are treated fairly. And that is very important because it feeds in the discussion on ethics. But also on the certification, and the point made by Finn. Both on certification and codes of conduct, the choice of the co-legislators was to make it voluntary. Also because there are mechanisms which have a certain cost, in particular certification. It is an element, among others, to demonstrate compliance, but it requires a whole apparatus. It requires criteria, involvement of accreditation bodies, of certification bodies. So there is, and which is in the process of being set up by the work of a Working Party 29. And also we as Commission are conducting a study to see whether we can provide empowerments, delegated or act. But indeed, this is an area to investigate. But I think we also need to see in this discussion between hard law and soft law that first we need to get it right on the hard law and to be compliant, not only with data protection, but as you said, consumer legislation and also the supply chain, because this is very important to have it. But I think this is a starting point, and probably in a year's time we will have, because we have now certification schemes on health already, and the discussion is also ongoing on the code on mHealth and how this will be continued under the European Data Protection Board. But there are avenues, but we have to first ensure the baseline scenario that is ensured.
Thank you. Irina, so we've talked a little bit about some of the policy implications. What do you see as some of the technical challenges here to solutions, to mitigating some of these issues?
Well, mHealth apps, and especially activity trackers, have a bit of a secret that's not very well kept, in that at least a third of the devices that are bought, people quit using them within 3 months. Within 6 months, depending on a country, according to recent studies, anywhere between 40 and 60% of the users sort of stop using these apps. Now my research group has done quite a lot of work on looking at the use of these applications and the use of these devices in workplaces and in private life. And what we found was actually something quite interesting. We keep talking about data, and we keep talking about data a lot here, and this idea that these devices are constantly collecting data. But there's something interesting about their design. They're designed to constantly collect data. The whole system is designed with the idea that you will continuously use it. And if you continuously use it, your health will improve and everything will be better. Now think about, is there anything that you continuously use all the time? Most of the time, unless your life depends on it, unless you have a chronic condition, most of our technologies we use what we call episodically. We use them for a while, we put them down. Even these things, all of us have one in a pocket, but occasionally we put them down and walk away. What happens when you have a technology designed to be continuously used, when the reporting is continuously used, when the goal setting is for continuous use, and the way people use them is episodic, well, you're never going to get to the goals. Your week averages are always going to be low. It's dispiriting. People quit. So on one hand, the industry needs to pay attention to the fact that their whole design, underlying design conceptions don't fit the vast majority of how people use these technologies. Thinking about what are some of the potential risks with not being upfront about the potential inaccuracy of the sensors, again, is something that is a design issue. So there are some design issues that industry needs to solve as well as addressing how they use data and addressing other problems. For this stuff to be really fulfilling its potential, we really need to think about both the devices themselves, the technical challenges that they're facing, as well as how they address data.
And I will briefly plug CDT's work here and then ask for your questions. So CDT, part of what we're trying to do, part of the reason that this topic came is because we're doing research on the analytics models that are used in mHealth apps. And what we're trying to do is come up with a sort of ethical model that the industry can use. And yes, this is a very hard problem, but it's one that we feel like we have to try to tackle. You know, the idea that these companies are using all these different metrics and values in these analytics models, but we don't know what they are, I think it is not going to last, right? That is not a sustainable strategy for companies. And so part of what we're trying to do is say, okay, well, here is an ethical model that you can use. We'll see how that goes. But please let us know if you have questions.
I have a question to the panel. Right now, if you install an app, it can read which other apps are installed. And with the explosions of health apps, we see that some apps just could draw profiles from this. So if I have a diabetes app or a depression app, some other app or even an integrated third party could read out that I use this app. So my question to the panel is, how does GDPR deals with this sort of data? Is it also protected, or are there any plans to go to the operators and protect it? Is there?
So maybe I can add to that point. Sorry, Pat Walsh, Privacy Matters.
You can answer each other's questions. That's
so
fine.
Look, we already have it all, right? So Finn, Michał, we have the e-Privacy Directive. Now, the important thing to remember about that directive and why it came about is not only the confidentiality of communications, and I would argue that the metadata that's communicated between these various entities, whether that's a wellness app, whether it's an mHealth app, whether it's a medical app, it's there for a reason. But actually, it applies, Article 5(3) applies to any data. It doesn't have to be personal data. So why haven't we seen enforcement on these issues? Because this is a really important point. The analytic code embedded in most apps takes this data, it collates that data, it adds it to other profiles that might be either maintained by the developer or by the platform, for example, Crashlytics, bought by Google in January 2017, Flurry, Yahoo, Verizon, now Oath. These are really, really serious things, right? So that's one thing. And then secondly, you raised a really good point about apps. I don't use an app, I delete it. So should there be a requirement that when I delete the app, that sends a signal that deletes the data? What happens to the data? And then on your third point, Michał, about certification, great idea. So you certify my app right now, you check to see whether it has any code in there that shouldn't be doing anything bad, right? I get my certificate, put it up on my website. Buy me, guys, I'm certified. Then I put the code in. So how do you deal with these issues?
Excellent question. Sure, we can take another question while we mull that over.
Yeah. So, Lucas Reinicke here. I will tell you a story. So United Kingdom is currently transposing GDPR into law, and the National Guardian, who is the most prominent person, something like Chief Privacy Officer for the entire nation, advised that there should be a ban of re-identification, and this is very interesting. On the other hand, it's regulating and banning a great chunk of privacy research. So instead of actually fixing stuff, companies might be inclined to more to maybe chase researchers. Why am I saying that? The National Guardian's background is medical doctor. So when we are speaking about medical apps or automated decision making, how can we make sure that those privacy impacts will be measured, assessed, and understood properly? So who will be actually tasked with this? Whether those should be people with in those hermetic closed circles, or whether this should be something like outside people, or...
Thank you for those questions. Panelists, do you have some responses? One to the metadata question of data being shared between apps.
Oh, I completely agree with you. I mean, I think it's outrageous. And we once, 2-3 years ago, we asked Google whether they could do something in their Play Store. And we sent them a letter and said, hey, why don't you actually, you managed to remove apps that are violating intellectual property, you managed to remove apps that are blocking ads that is opposed to your business model, but you don't manage to remove apps that are clearly in breach of the law. We never received a reply. So, yeah, and so I think this is definitely something we will try to look at, and I think it should be enforced. It's outrageous. And to Pat's question, I agree completely with you, so I don't know if I will add anything more to what you said, except that we looked at apps, and we looked at their terms, and we looked at their deletion. Will they delete data after inactivity? And none of the apps we looked at promised that they would delete apps after inactivity. And we could say maybe a year, maybe 6 months, but at least delete data. And so your point is correct. You know, people deleted an app after 3 months and they think the data is gone, but it's not. It's saved forever.
I want to just stand up for the industry for 1 second, and I'll just briefly make this point that data deletion is not as simple as it sounds, right? I mean, we did a report on this last year, and you know, the data is spliced into a million different ways, and they're all in different packets all over different databases, right?
We understand that, Michał.
Yeah.
That complexity and the lack of simplicity should not be the individual's problem.
Oh, I agree. No, I agree with that.
You can stand up for the industry if you want.
No, just more pointing out that we as policy makers sometimes say broad statements, and I've had to have this conversation with lots of different companies, and it's partly because that's, you know, we're not going to get into the minutia per se when we're having these kind of discussions, but that it is exceedingly difficult to know how to delete data in a way that makes sense for the company, right? When it's been mixed into so many other data sets. This is not a simple question, that's all I was making. Go ahead.
Yeah, but even if it's not a simple question, I mean, companies have to deal with it, and effectively, because the GDPR already, the directive requires it. Okay, the level of compliance is low. So, but we hope the level of compliance will increase, and where we see a missed opportunity for companies because people refrain from using a mobile apps application because they fear about how their data will be treated. I see a huge opportunity for the increasement of privacy compliance. So I'm quite glad about that. And I hope this will push, I mean, companies for more compliance. But on the issue of deletion of application and data, I do not know by heart. I've studied a little bit, quite the code of conduct, but a few weeks ago, it is in the draft, the current draft. So it's one of the issues they intend to, the code of conduct intends to address, and how to really deal with, okay, you want to delete the app, what can we do? Can we keep your data or not, etc. And this is, again, another opportunity for the code of conduct to bring very valuable contribution to the interpretation of the GDPR in this specific context.
So I'm not one to apologize for the industry, but there are actually significant technical issues in terms of when you install an application, especially if you have an Android device, and especially if that application is on the expansion card. Most of the memory expansion cards don't actually provide a way to prevent an app that you've installed from grabbing a bunch of data from other apps that might be sitting on that expansion card. It's part of their, so Google's been working on this problem for a while there. They wouldn't allow you to use expansion cards and things like that. So there are also technical issues with how data flows within operating systems can be controlled and what can be controlled. Obviously, the app that you install and that grabs that data and builds a profile of you, that's unethical. And we don't want them to do that. Then again, we don't exactly have particularly good code scanning tools to ensure to see that the apps that are in these app stores are doing what they're doing. So occasionally they do the scans and they find some apps. But again, there's a perennial problem going on, right? We need a lot of technical tools to do this. But let me say one thing. The legacy issue, the fact that you have data, and there's an interesting issue that's been going on for the last decade that we've been studying these issues. A lot of the companies never even thought what they're going to do, whether they need to delete, and what are they going to do with the data that's left over. That wasn't even part of the decision making. It just wasn't an issue. They had storage, the data was there, they never thought about having a policy. Now, GDPR is going to force a policy, which is going to be great, because literally just a few years ago, we'd be talking to a company and a question would be, so how long are you keeping the data? What's your policy on deletion? They'd be like, what policy?
So you think we haven't had data protection law for the past few decades, right? That's been a legal requirement. I'm sorry, but that's been and then when it comes to the data protection by design of default, sorry, the industry has known since 2012 that this is going to be a reality. So 6 years. How much time do people need?
Well, you have startups that don't have the resources to really get a handle on a fairly complicated set of rules and requirements. One of the things that we've been working on is actually trying to develop tools to help startups navigate what are the do's and don'ts and how to do this. Lawyers are expensive.
CDT has some best practice app guidelines, I think.
So we have also the guidelines done by the Commission yesterday on how to implement GDPR, because I think that at last Commission understood that this is not so good project. Yeah? There are many issues, problems, concerns in many countries. But one question related to deletion of the data, when we are talking about apps, it's clear, much more clear. But when me, as patient, and my doctor will take some data from apps to electronic health records. So it should exist. It should exist. It doesn't matter if apps will exist or not. Yes, it should exist because this is the story of my state of health, and it could be useful. Yes, so we need to remember. Of course, this is the additional question related to the security and the full privacy protection for those electronic health records, yes, but this is one of the key issues.
We'll see what happens.
And final point about ethical issues, yes, because I think that we are very often talking about the situation in which somebody is taking data and if he is behaving in positive sense, fairly or not. But we need to confront with a completely new problem related to the situation in which algorithms are taking our data. Not somebody, not company. You know, I understand that this is a completely new discussion and debate, yes? But when we are talking about ethical issues, at the same time we need to discuss about health data, but about artificial intelligence and algorithms. It's a complex solution, yes, so.
Thank you, sir.
I'll just maybe echo and cannot but agree more with one point from the audience that was made. I think what 20 years of data protection law taught us was that if I want to actually do a business, I need to know the rules. And this is no different in data protection law and competition law or any other type of law which exists in a jurisdiction where an operator wants to function. But I think what is key, because Michał was saying, of course, data are split, but this is the question. Do I know my data cycle? Do I know where the data goes and for what? And I think, of course, I want to seize the advantages, do innovation, do growth, of course, but I need to know and to be able to tell where each data is. Otherwise, there's no accountability, and otherwise, I cannot also assume trust. Finn was mentioning, exactly, and I was saying this morning. Look at the Eurobarometers. There's even higher rates of lack of trust of individual for online environment, for clear reasons, because they do not know. On the guidance from the Commission, this is also to address the issue of SMEs. We tried without interfering with the role of data protection authorities which are issuing the guidelines, but also to give awareness and to give a snapshot of what this regulation is in order to, for this, because it's available in all languages, in order this to be disseminated further. We had workshops with SMEs and also with 200 health professionals. You'll see the report, also in order to try to, again, bring this dimension for more to the front, and we will continue doing this. Thank you.
Thank you all so much for your attention, and thank you, panelists, for being here today. Please join me in giving them a round of applause.